Well, I will tell you, one thing, just like you're talking about, in socialized medicine or in our insurance medicine in the United States, it's not a free market.
No.
So that's why service sucks. That's why quality sucks. That's why it's expensive. And people will say, well, but wait a minute, I've got Premier Blue Cross, or I've got United Healthcare. I don't have government insurance. Oh, let me tell you, it's so highly regulated, it's government insurance.
Yeah.
Because through the ACA, like they're told what to pay for and what price to pay it at. There is no free market whatsoever in traditional insurance. Now, here's what I will say, and here's what I talk about in my book. Here's what my wife and I do. Here's what we tell patients to do. If you want to be liberated from that system, you don't have traditional insurance. You have a health sharing ministry or a health sharing account.
Which ironically, and it drives me nuts. So you'll hear MetaShare and some of those in their commercials, and this is because they have to, right? But you'll hear them say that now this is not insurance, but yet it is expressly insurance. It's actually it actually fits the definition of real insurance.
Right. Well, I'm assuming the reason they can't say that, Bryce, is because it's a legality from the government.
Yeah, no, it's a regulatory issue. I just find it. I just laugh every time I hear it because I'm like, actually, it is. But
right. And here's I'd like to hear your opinion about this, because the naysayers with the health sharing ministries, they'll say, "Oh, I'd never trust a health insurance a health sharing ministry to pay my medical bills," and I would much rather trust an insurance company because they're regulated by the government. It's like, I'm like, seriously? I've worked on both sides of health insurance. As a patient and as a provider, I would never trust them at all.
Yeah,
to pay anything. And let's remember this, Bryce. 50% of all bankruptcies that are filed on healthcare bills, over 50% of those people had insurance.
Yeah. And no, it's a complete mess, and it's a broken system. And I, sit down with clients still to this day, and I tell them that, we're witnessing, not the collapse of you heard my speech the other day. We're witnessing the collapse of a lot of things, including our republic, but health care has collapsed in the United States. And that's why people are seeing that their bills aren't getting paid, or they're having trouble accessing care. I mean, that, it's getting harder and harder to access care now because the system is so broken. Again, they've doubled down on all of the worst ideas and all of the worst policies on the planet. And then, of course, it isn't also insurance at all because it's not being really underwritten. Right. Nobody, people are digging their graves with their spoons, and they are making terrible decisions on a daily basis for them. And yet they don't pay any more than the person who is engaged in that system, who is making really tough decisions on a daily basis to keep themselves healthy. And they're, eliminating the crap from their, household pantries and, all of those sort of things. And so there is no penalty for you being morbidly obese and things like that within our current system. And so, all of that stuff serves to really exasperate the issues that we're facing.